Guys, welcome back. Your kids are going back to school right now, and that means they might be a little bit more susceptible to getting sick. We're here with Dr. Rogelio de la Cruz. He is the director of the Pediatric Emergency Center at Navicent Health. And Doctor, thank you so much for being here today.
Good morning.
Awesome. So let's talk about it. Obviously, you get into a new place, especially younger children, maybe elementary school age. They are a little bit more susceptible to some of those things that can get us sick, but fortunately, there are ways to treat it. So let's talk a little bit about some of the most common ones that you see kids might have, maybe some coughing or diarrhea, something like that.
Yeah. So when kids go back to school, you're right. Cough and vomiting, diarrhea are very common, especially when they start school. As far as diarrhea and vomiting, you hear this from doctors. It's most likely from viruses, and it's true. Most diarrhea and vomiting in children are from viruses, and there are home treatments that you can start. You don't have to bring your children to the doctor. So if they start having vomiting, you can try them on some clear liquids every 5 to 10 minutes. You can give them some brands like Pedialyte or Enfalite. The advantage is it's got balanced amount of glucose and electrolytes.
Mm-hmm.
The only reason you should really bring your children to the emergency room is if they have vomiting and they're having severe abdominal pain, headaches, rash, or if the vomit has some fecal material. Those are emergencies. You need to bring them to the doctor. But if it's just simple vomiting and they're able to tolerate a few sips of drinks every 5 to 10 minutes, then they should be all right to stay home.
That's the biggest thing, I think, is to keep them hydrated, because
Yes.
when you're throwing up, you're going to lose some of those electrolytes, things like that.
Exactly.
And that really is a good thing, because you don't want them to go to school. Not only do they feel terrible, but there's also a chance of passing it on to somebody else. That happens a lot, doesn't it?
Exactly. Yeah. It's easy to pass other viruses to other children. In addition to vomiting, they will also present with diarrhea, and again, it's not always an emergency. Diarrhea, you can treat them at home. The only reason why you should bring them to the doctor is, again, if the diarrhea is associated with blood, or
Right.
if a child has high fever, then you should bring them to the emergency room or to the doctor immediately. Otherwise, you can just treat these illnesses at home.
Gotcha. And any tips for diarrhea really quickly?
For diarrhea, be sure your children wash their hands. When they go to school, be sure they don't eat food that were left open for a long time. And if they're having diarrhea and vomiting, do not wait. Tell your children to tell you right away so that you can monitor them for dehydration.
Yeah.
Because children, compared with adults, have a higher amount of body water, so children are more prone to dehydration.
Definitely.
So when children have vomiting and diarrhea, they can get dehydrated really fast.
I believe that's really the biggest thing. Well, Doctor, thank you so much for the good information
You're
today.
welcome.
Thanks for being here. And we'll definitely have all this information on our website. That's 41nbc.com. We will have more Daybreak for you right after this. Stick around.